Gaza's healthcare system is on the verge of total collapse as Israel continues its relentless and systematic destruction of hospitals, medical workers, and essential services. This calculated assault is not just a humanitarian tragedy, but a deliberate act of collective punishment against the Palestinian people. Tonight, we uncover the harrowing details, including the tragic disappearance of Dr. Hussein Abu Safiya, and discuss the far-reaching implications for Palestinian civilians. Let's get into In Focus. The relentless and deliberate attacks on healthcare facilities in Palestine have drawn sharp condemnation from international organizations. A report by Doctors Without Borders highlights a year of continuous strikes, raids, and incursions on Palestinian healthcare infrastructure, emphasizing the devastating impact on civilians, the destruction of hospitals, and the targeting of medical professionals such as Dr. Hussein Abu Safiya is a glaring example of Israel's disregard for human rights and international law. These crimes demand urgent global action. Now, joining us to provide insights is Mr. Ahmed Fattouh, spokesperson of the Palestinian National Liberation Movement, Fatah. And good evening to you, sir. And Mr. Fattouh, how would you describe the current state of Gaza's healthcare system, and what are the immediate needs of the population? Hello, Dr. Ahmed. Mr. Ahmed.
Hello, مش سامع. لا مش سامع.
Can you hear me now? Hello. Hello, Mr. Fattouh. Again, let me repeat the question. How would you describe the current state of Gaza's healthcare system, and what are the immediate needs of the population? Hello? Mr. Ahmed Fattouh, can you hear me?
Sorry, there was some disconnection. Can you hear me?
Yes, I can hear you. Can you hear me now?
Yes, I hear you now.
Right. So thank you for being with us on Qnews. And let me again repeat the question. How would you describe the current state of Gaza's healthcare system, and what are the immediate needs of the population in this very stage?
The healthcare system in Gaza is suffering severely. There is a huge amount of destruction in hospitals that went out of services. More than 30 hospitals went out of services. As well as more than 1,000 medical staff has been killed and 3 executed in Israeli custody. There is more than 350,000 cases that are suffering from chronic diseases that need urgent care, but there's lack of medicine and medical equipment. So the system is collapsing, and there's a deliberate targeting of the healthcare system by the Israeli occupation, by limiting the aid, limiting the medicines, limiting medical equipments, as well as attacking and targeting, medical staff and the aid trucks. So there's a clear intention by the Israeli occupation to cause a humanitarian crisis in Gaza. The healthcare system is suffering from a disaster right now, and how we could solve it. First priority is to allow air trucks to enter. We can't do anything without medicine, without medical equipment. And this targeting of the healthcare system, the care of doctors, must stop immediately, which require an immediate intervention by the international community, by the World Health Organization, by United Nations, by all the relative institutions to stop this crime against humanity.
Indeed, indeed, and we'll speak about exactly the what is demanded from the international community. But before we go into this, now we've seen the arrests and the reported torture of Dr. Hussam Abu Safiya. This has really raised international concern. Now, how does this case reflect the broader challenge faced by healthcare workers in Gaza?
Sorry, could you repeat the last bit?
How, from your point of view, does this raise concern about those who are working or those who are working in the health system in Gaza?
Well, there has been many reports and investigations by global organizations such as the United Nations, such as the Human Rights Watch, B'Tselem, even Israeli Human Rights Organization, Amnesty International, all has documented a deliberate targeting of civilians, of healthcare system, of hospitals, of doctors, and those who hold experiences. So the world is aware of what's happening on the ground.
Yes, we're also shedding light about the arrest of one of the doctors, Hussam Abu Safiya, Dr. Hussam Abu Safiya, and his torture. And how does this reflect on the dire and very dangerous situation already?
It's not changing. The people in Gaza are still suffering. That I'm sure that there is a word out, there is awareness now, there is some pressure that's going out. But Israel is continuing committing these crimes against humanity. It's not helping. Dr. Hussam Abu Safiya, everybody has witnessed how he has been arrested while dressing a white coat in front of all the world on live TV. A man armed with science, with faith, with his humanity. Israeli tanks that represent this cruel, this dangerous behavior of Israel that is destroying our humanitarian law, destroying our international order, destroying all values that we share in humanity.
Now, under which exactly pretext was he arrested?
There is no, of course, Israel would always make the excuses that there is Hamas bases, Hamas personals, but they never provide any evidence. We are waiting for them to provide any evidence. They never. And in any case, hospitals and healthcare institutions are protected by the law, by the international community. They cannot enter there and just arrest people here and there based on, undocumented, provided evidence, and just claim that we are, fighting Hamas. Mm-hmm. This is a pretext for everything: invading hospitals, bombing schools. What excuses they have to kill children and women and elders? To kill, let's suppose, one Hamas member, to kill 100 civilians for one Hamas member. That's against the law. And there has been reports, and there has been, by Haaretz, even Israeli newspapers, who has revealed that there are soldiers and officers who are leading units for exterminating. That means they would kill 100 civilians to one Palestinian fighter. This is, it's a huge crime against international law. This is a catastrophe.
Now, with only 16 out of 36 hospitals partially operational, how is Gaza coping with the overwhelming number of casualties and life-threatening injuries?
As you see, there's death toll is rising horrifically. The numbers, by the way, today we say that it's more than 45,000 and 800 are killed. But believe me, after the war settles down and the fire settles down, the numbers will be massive. There has been reports that issued a study that says estimate that the true numbers could exceed 180,000, because there's people who have died from the lack of medicine, those who have kidney diseases and need medicine, who died because they couldn't find this medicine, those who have heart conditions, who died because they couldn't find this medicine, and so on and so forth. This number is going to be massive. Of course, those who died from starvation, from unhealthy condition, from pollution. So the numbers are going to be catastrophic. How Gaza is coping? Gaza is coping by the social solidarity, by the resilience of the Palestinian people. The doctors are working day and night to save children, to save women, with anything they have between their hands. They have been the heroes of this package is the doctors, the healthcare system that did not, afford any effort to save the people in Gaza. There is a few amount of aid that's entering Gaza, and if you have read the report by the UN yesterday, Israel is deliberately targeting aid trucks, and also we have the gangs that are stealing these aids, and Israel is allowing this to take place and to happen. So without medicine, without medical equipment, and without allowing the doctors to continue their work, it's difficult to save lives, especially that Israel has killed many experienced and well-skilled doctors who are needed for critical operations.
Now, the WHO has termed these attacks as part of a systematic dismantling of the health care system. Of course, you said here that 8 trucks are already targeted, and we're also speaking about the prevention of aid in the first place to take place. Now, how do you think this reflects on Israel's broader strategy towards the Palestinians?
There is an increasing pressure within the United Nations and the Human Rights Organization against Israel. And Israel is, some positions in Europe has been changed to pressure more on Israel.
No,
but the main
I'm speaking here about, I'm really speaking here about the, how do you see all this happening as a kind of strategy, of Israeli strategy towards, or its broader strategy towards the Palestinians in this case?
Their strategy from the very beginning was set by Netanyahu is ethnic cleansing and extermination. I'm sorry, is that a question? What's the Israeli strategy from what they are doing in Gaza?
Towards the Palestinians. They are preventing aid, they are targeting aid, they are targeting civilians, they are targeting the healthcare system. What do you think their broader strategy is?
Yeah, the strategy is, as he said from the 8th of October, he said that this is a new Middle East. This is the scheme, which means he is planning for an ethnic cleansing campaign against the Palestinian people in Gaza, as well as in the West Bank and in other areas, trying to forcefully displace them to Sinai Desert. Of course, our brothers in Egypt firm position against this plan has halted these schemes. But that did not stop Israel from decimating, from destroying Gaza, healthcare systems, schools, refugee places, the food, the starvation, the water resources.
Yes.
This is trying to push people toward,
very clear, Mr. Ahmed. Very clear.
Yeah.
We thank you so much, Mr. Ahmed Fattouh, for sharing these critical insights for Israel's systematic destruction of Gaza's healthcare system. The atrocities being committed against Palestinians must not be ignored, and the global community must take action to stop these crimes. Now let's move to the recent developments in Yemen. And the Houthi missile and drone attacks on Israel have added a new layer of complexity to the already fragile geopolitical landscape of the Middle East. These attacks, a direct response to Israel's aggressive policies and occupation, exposed the vulnerabilities in its defense systems. The Houthis have mounted a series of operations that challenge Israel's military strategies and highlighted the growing resistance against its oppressive actions. Now, the Crater recent article shed light on the Houthis' missile and drone attacks, framing them as a significant challenge to Israel's military deterrence. It also explores the evolving role of the Houthis within the axis of resistance, highlighting the group's tactical adoptions and strategic implications for the region. This context underscores the growing rejection of Israel's oppressive policies across the region and beyond. Now we're joined by Mr. Abu Bakr Bazib, President of the European Polling Center. Good evening to you, sir, and welcome to Qnews. Mr. Bazib, how significant are the Houthi attacks on Israel in the context of the broader Middle East resistance to its occupation policies?
Unfortunately, from the near perspective, there are no facts or support that would the Houthis attack would achieve. On the contrary, they never provided anything on the ground, or at least to mitigate the state of humanitarian against the Palestinians. It's their only they only just give alarm to the Israeli to go to their own shelters, and it goes in the system of Iran axis that is trying as much as possible as to hit the Israeli dips and the state of occupation. But rather, he contributed along with Israel to hit the Arab security to the Red Sea and the Arab island, as well as the path of the international maritime. And I can see that targeting the Houthis aren't only from the Houthis, but the guardian of prosperity made by the US and Britain, where ultimately it is hitting the Yemeni dips and, of course, damaged the Yemeni interests.
Now, some analysts argue that these attacks are part of an Iranian strategy to counterbalance Israel's aggression. What's your take on that?
Ultimately, we should to put what is made by the Houthis in its right context. They are militias working according to the Iran system in the region, either in Lebanon, Yemen, and Iraq, and previously in Syria. Now, Tehran practically lost what they've done in Syria and violated the Iraqi militia. Today, there is nothing left of what the militias of Houthi is trying to do. And I think it is a type of the political suicide. The Houthis are not able, for many reasons, to continue hitting the Israeli sites. In the meantime, they are trying to enter the region in a way or another in a state of worried. We should indicate that the Israelis to continue hitting Gaza are one of the main reasons to the presence of the concern in the Arab region, especially in the Middle East. Therefore, Israel should be complied to the international pressure, particularly upon the arrival of Donald Trump, to stop the hostilities as well as the genocide in order to spare the pretext that the Houthis and the other militias are doing their attack based on.
Right. Now, given the advanced weaponry employed by the Houthis, how effective has Israel's military response been so far?
Firstly, Houthis has inherited the armed personnel that were in the Sana'a, in the capital. In the meantime, Sana'a has 2,500 of a coastal line as a vast area, several of pirates and the armed mafia to deliver the several hosts of different types of missiles. Therefore, the Iranian expert in Sana'a, by the assistance of the Houthis, to make it or manufacture it. And of course, they are advanced, and it has a military capabilities. There are no estimation of their numbers, but they're trying as much as possible to achieve some sort of victories by using one missile or two in different periods. The dilemma that we are before, that the Houthis militia do not spare themselves a way to go back. They have nothing but two solutions. The first one is to have a victory against Israel, which is a dramatic and dilemma. Cannot be isn't applicable. And the other thing that would have the same fate as Hezbollah, that would require a long time and and the assistance of the Western intelligence, and then the infrastructure of Yemen will be demolished at large, and the humanitarian crisis at large, based on the international report that stipulated that 85% of the Yemenis are at the line of poverty, and therefore would cause a great crisis. And the Houthis aren't concerned about it, and they think that they wouldn't lose anything. They are not concerned about the internal situation in Yemen, rather the humanitarian crisis of the Yemenis.
What does the Houthi strategy tell us about the group's long-term objectives and their role in resisting Israeli aggression?
From my own perspective, they have no two types of objectives. First one, tactical objectives, by saying to the word, I'm here in a very sensitive area, in the geopolitical area, such as the Red Sea and the Bab el-Mandab Strait, and I can harm the international maritime and should be seen as a real player in the region. This is a regional objective. Their international goal, what does Iran wish to achieve in the whole world, and say to the whole world that I dominate, and I'm in the Arab Gulf, and I have the support from my allies in Bab el-Mandab Strait, and I'm capable, while being excluded, to provide or make a great damages of the current landscape. Therefore, the bed of the Palestinian case, we've seen in the past through the Iranian axis, as the Palestinian cause is the Arab central cause of the Arab Street, and before everybody, they have nothing better than the Palestinian cause through which they bid in, and which is not true, as they claiming that they support the Palestinian, as they've seen in anywhere else in Iraq.
Yes.
And they have also a set of objectives that achieve for them a presence in the reality through which they try to achieve some of the international and regional objectives.
Right. Thank you so much, Mr. Abu Bakr Badib, for providing such a detailed analysis of the evolving conflict, and the Houthis' resilience and Israel's vulnerabilities highlight the growing opposition to its policies of aggression and occupation. That brings us to the end of our episode for In Focus today. Many thanks for watching, and stay tuned for more updates on Qnews.